Thank you, Gary. Good morning. On behalf of Superintendent Hoffmeister and the Office of Federal Programs, my name is Tammy Smith, and I would like to welcome you to our webinar this morning entitled Strengthen and Increase Family and Community Involvement to Support Homeless Children and Youth's Education. What we're going to talk about today is how homelessness impacts our students, the importance of focused efforts to identify and reach out to families experiencing homelessness, understanding family homelessness. We're going to review the concepts of family engagement and how to take a strengths-based approach to getting our families that are experiencing homelessness involved. And then we're also going to talk about collaborating with community partners. So students experiencing homelessness are more likely to experience acute and chronic health problems, for instance, asthma, and oftentimes they have inadequate access to medical and dental care. They also are more likely to have more social, emotional, cognitive, and physical development delays, such as language, fine motor, and social skills. They are at a greater risk for behavior problems in school. Think of the challenges in focusing attention, just to name one. And we see that they have a higher percentage of poor academic outcomes. You know, they are more likely to be chronically absent, have lower grades, oftentimes have special education needs, and are more likely to drop out of school than non-homeless students. So we know that children who are experiencing homelessness needs extra support from us. The importance of identifying and reaching out to families experiencing homelessness. Families experiencing homelessness may not disclose their living situation or see themselves as homeless. They may keep their situation and circumstances hidden from friends, teachers, and others because they feel ashamed or are embarrassed. They may also hide their living situation if they fear child welfare involvement. Those experiencing homelessness may not know what services they qualify for or where those services are located. So each community that they move into has a unique patchwork of programs and services. Families may find this confusing, and they may not understand how to access services, especially if they are in a crisis or they've moved to a new community or state. So identifying families experiencing homelessness is both necessary and challenging for a number of reasons. Families experiencing homelessness can be invisible in communities, which means typical recruitment and outreach efforts may not reach them. Most families experiencing homelessness do not live in shelters, and they move frequently. They may seek resources, supports, and assistance to meet their basic needs in places such as motels, food pantries, soup kitchens, and thrift stores. Each community has its own network of supports and emergency services. And of course, these all look different for your rural, urban, and suburban communities. Families experiencing homelessness may be unable to take advantage of typical parent information and enrollment services because they are without resources or without a stable address. So web-based parent education and information sharing strategies may be effective for reaching some families, but other families may not have access to the internet, computers, or smartphones or mobile phones or other electronic devices. Family members may be hesitant to provide an address if they are not sure they should use the address where they are staying, especially if they do not know how long they will be staying there. Families experiencing homelessness face barriers to enrolling and participating in education and may require accommodations to complete enrollment requirements and continue participation when they move. They may not have what they need to apply for and participate in the various programs for their children. Homelessness can create barriers before um, enrolling, that barriers to access, and then to ongoing participation, barriers to continuity of care. So for these reasons and more, districts should have procedures in place to identify children and families in their community that are experiencing homelessness, prioritize these students for service, and remove as many barriers or all barriers as possible to enrollment and participation. Being sensitive to families' living situations can help identify and connect them to appropriate services and sources of support. Understanding family homelessness. Many factors can lead to families experiencing homelessness, including one or more of the following: lack of affordable housing, eviction, or changes in housing support policies; poverty, often caused by low wage, employment, unemployment, and lack of education; challenging socioeconomic situations; health challenges, including mental health and addiction; natural disasters such as tornadoes and floods, which we are very aware of here in Oklahoma; and issues related to immigration. Families experiencing homelessness have stressors that may require special attention, understanding, and sensitivity. Families may feel stress due to unmet basic needs and lack of resources to ensure a safe home environment. They may be uncertain about asking for information or unclear about where to find help. Embarrassment and discomfort when parenting without privacy, personal space, and the ability to control basic family routines, such as in a doubled-up situation. They may feel shame, fear of judgment, and worry about child welfare involvement. And oftentimes, they may be reluctant to form new attachments because they know that they're possibly going to be moving away soon because of their circumstances. So for those families experiencing homelessness, they may require us to find new or unique approaches to engaging them just because of the complex nature and challenges they face as a homeless family. Families may be experiencing separation from their usual social supports, including family members, friends or neighbors, community providers, and others they see often; barriers to stable employment and inconsistent access to child care, school, and other community services; and domestic violence, addiction, or other issues related to physical or mental health, such as depression or anxiety. Okay, family engagement. Family engagement is an interactive process through which family members, their children, and professionals build positive and goal-oriented relationships in support of positive outcomes. It is a shared responsibility of families and professionals that requires mutual respect for the roles and strengths each has to offer. Family engagement means doing with, not doing to or for, our families. At the school level, family engagement involves parents' engagement with their children and with staff as they work together toward the goals that families choose for themselves and their children. The homeless liaison, teachers, and other staff members should work with families, other professionals, and community partners to promote equity and feelings of inclusiveness. Using a strengths-based approach to connect with families, this strengths-based approach to build relationships can be a part of effective family engagement. Successful relationships focus on a family's strengths and a shared commitment to their child's learning and well-being. Families experiencing homelessness may especially benefit from engagement efforts that focus on their parenting strengths, passion for their child's well-being, and aspirations to make progress towards stability. A strengths-based approach to partnering with families means acknowledging the strengths of families first, building shared understanding and learning from differences, sharing decision-making about their students, approaching families as equal and reciprocal partners, seeing families as capable of making their own change, and striving to provide consistent and reliable support. A strengths-based approach includes adopting a positive way of thinking or feeling about families. Using this approach shows them that you want to work together to problem solve. Strong and stable relationships with families often become partnerships that are grounded in an authentic concern and respect for each child and family. So consider the following statements. All families have strengths. So each family has unique strengths that can be the foundation of your discussions and partnership. Always start with their strengths first, even when there are challenges. Secondly, families are the first and most important teachers of their children. Families are the one constant in children's lives. Children's healthy development also relies on sensitive and nurturing interactions within the family and community. Thirdly, families are our partners with a critical role in their child's development. Families make choices every day that affect their overall well-being and their child's development and learning. These choices are rooted in their belief systems and cultural identities. So we want to meet with them and help them with their choices. Fourth, families have expertise about their child and their family. Families understand their children best, and they make important decisions for their well-being. Lastly, families' contributions are important and valuable. Being open to a family's suggestions and requests helps us to do our best on behalf of their child. We can encourage effective partnerships when we invite families' expertise and listen to their priorities. Collaborating with local partners to identify and reach out to families experiencing homelessness. Entities where families may seek temporary housing or shelter are potential partners for identifying and enrolling children experiencing homelessness, and these may include your local motels, hotels, trailer parks, or campgrounds. If you have emergency shelters and transitional and supportive housing programs in your area, it could include those. Your local United States Department of Housing and Urban Development, or HUD, and other public housing agencies. Community action, faith-based, and other nonprofit social service entities providing emergency and temporary housing. Laundromats, 24-hour businesses, and other public spaces where they can get in out of the weather or whatever, someplace that they can stay. Working with partners is a key strategy for serving families experiencing homelessness. Partners may include other early childhood and school-age child care programs. Partners may also be programs and services specifically focused on supporting children and families with issues related to financial well-being, health, safety, or other service needs. So again, places in the community where families may seek resources and supports for their basic needs are also potential partners. These may include food pantries, soup kitchens, thrift stores and clothing closets, medical facilities and mobile health clinics, public benefits offices, community action, faith-based, and other nonprofit social service entities that provide for basic needs. These resources may be good places to communicate with families about access to programs and enrollment. Outreach efforts may include regular visits to share information with families and staff about available early childhood and school-age student resources in the community and in the school itself. Consider the community partners that you work with who provide supports to children and families experiencing homelessness, and those with whom you might connect. For instance, early childhood and school-age childcare, such as Head Start and Early Head Start, pre-K programs, child care resource and referral agencies. Under nutrition, you would have WIC, SNAP, school breakfast and lunch programs, summer food service programs. When thinking about health, we want to get them hooked up with Sooner Care if they're not already. Social, emotional, and family support, mental health and substance abuse treatment if it's needed, domestic violence, child welfare, protective and voluntary services, family well-being supports, to help with economic and self-sufficiency. They might need some help with through TANF or SSDI and SSI. The parents may need help getting their GED or other adult education. Certainly some of our EL students, their parents may need help with English literacy. We can also point them in the direction of workforce development and job training. Housing, help them with public housing or Section 8, transitional and supportive housing. Local realtors and landlords, help them find a place that they can live. And then additional social supports would be your community action, faith-based, and other nonprofit organizations. And your local continuum of care can help with this. So a best practice, these are just some of the partnerships that you in the district should cultivate and have. And then a best practice is to have a flyer available to hand out to parents and unaccompanied youth, don't forget those, who are experiencing homelessness, that list the resources that are available in your community with contact information and any requirements that they would have to meet to qualify for the assistance. So when that homeless family comes and enrolls their student, you have this list available to hand to them and say, how can we help you? And these are some community resources that might be able to help you. And that is the end of my webinar today. Are there any questions out there? If you put those in the chat box, questions or comments. While you may be putting in a question or comment in the chat box, none of these are our resources that I used for this PowerPoint. This PowerPoint will be posted to our website probably the first of next week before it's posted there. And this is my contact information here. No questions? Okay, everybody have a wonderful day. I'll be back on Monday afternoon to do a webinar letting you know more about kickstand training. Have a great day.